What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, and testing negative for those viruses. It is time now for the Tuesday edition of the Virus Update for Tuesday, September 16th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, but there's not enough media coverage. That's where I come into play to give you the latest news, data, and anything I can find to help keep you safe and informed of what's going on with these viruses. Want to stay informed? Just subscribe to my channel down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below, and ways to support the channel are listed down below already. We have a ton of things to get through today, including several news stories and pieces of data, and then we do have some data from CJS, and then we do have some other stuff that we're going to take a look at as well. Starting off today in New Zealand, where the New Zealand weekly COVID update from Dennis the COVID Info Guy is out. This is from September 8th through to September 14th. New cases in New Zealand of COVID, 319. Hey, that's down by 9.3%. Reinfections, 176, or 55.1% of the cases. Deaths, 2 at this time, down by 71.4%. Total deaths, 4,789. That actually went up by 2. In the hospital, 37, down by 26%. In the ICU, like always, not available at this time. 55.1% of the cases were reinfections. Sadly, the total number of deaths is actually 15. 2 deaths were attributed to COVID, 1 not COVID, and 11, well, status just was not available. 2 of them were in their 50s, 2 were in their 60s, 1 was in their 70s, 6 were in their 80s, and 4 people were over the age of 90 this week. Of these people, 5 were women and 10 were men. So there you go, New Zealand. Moving on now to Australia, Queensland Weekly Respiratory Surveillance Report from September 9th through to September 15th. Reported cases of COVID, 670. That's down by 11.4%. That's good. Influenza, still a high number, though a number that's dropping. 3,498, down by 15.6% of cases. RSV, 848 cases, or down by 1.6%. Hospitalizations, 54 for COVID. That actually went up by 1.8%. Influenza, 207, or down by 11.9%. RSV, 48. Hey, that's up by 11.6% at this time. Alrighty, moving on now to this from Raj Narayan. I hope I said that correct. The status of COVID-19 in California. I thought this was interesting to share. Oftentimes I will retweet and see his work. I don't always share it. In this case, I'm going to because we've heard of the XFG.3 variant before. Correct? It's another version of XFG. We all know about XFG itself. XFG.2, there's one I don't know much about, or PQ.2, are the top circulating SARS-CoV-2 lineages in California. Low sequence count. Yeah, we don't do a lot of sequencing here in the United States, and California is no exception, but I find it very interesting that one of the top ones circulating there is the XFG.3. And we know California is still doing very bad at this time, and wastewater is still very high in California. In fact, he provided that. Take a look at that. It is still very high in California, so interesting to see XFG.3 being the first one he lists here. Moving on now to the PMC COVID report for September 15th, 2025. We are not going to read this whole thing. There will be a post on my site today of everything used in this virus update, all the news stories and X posts, because there's a lot of them. And, well, we would be here all day if we read this whole thing. But what you do need to know is COVID-19 levels are very high or high in the majority of states per the CDC. This includes 27 states and Washington, D.C. Very high are Alaska, Hawaii, California, Nevada, Idaho, Utah, South Dakota, Nebraska, Texas, Louisiana, Indiana, Kentucky, Tennessee, Florida, South Carolina, North Carolina, Maryland, and Connecticut. High would be Washington State, Oregon, Montana, probably North Dakota, Arkansas, Alabama, Virginia, Delaware, Rhode Island, and Massachusetts. PMC estimates 1 in 38 people, 2.7%, are actively infectious. Wastewater cases estimate at this time 1.3 million daily infections. So, yes, as of yesterday, still 1.3 million daily infections. And you can see here's just some states. He does show most of the states. And, like, for example, let's see Florida. Florida is still 1 in 24 infected there. Hey, District of Columbia, Washington, D.C., 1 in 17 people infected with COVID at this time. Yeah, that's, wow, that's really high. Indiana, 1 in 16. I'm just randomly going through some of the worst ones here that I'm seeing. Utah is 1 in 16. North Carolina, 1 in 17. And you know what? Let's go back for a second. California, yeah, 1 in 21 there. And then there are some states that are not doing bad. Hey, New Mexico is 1 in 106. Missouri, 1 in 109, which, though Missouri is very low, Missouri is coming up in the news here in just a second. Yes, Missouri is in the news. We are still during COVID today. I actually tweeted that myself yesterday or day before. Right now, we are still during COVID. And, yep, the United States does experience waves multiple times a year, usually 2 a year. That's what we've been doing as of lately. And you can see here on this chart here, back in 2022, the Omicron was the big giant wave. This current wave, if you look real close, is not as big as the wave that we saw last summer. All right, moving on here. I want you to see this. Last week we noted the following as a plausible scenario. A very large retroactive correction could shoot the peak substantially higher. In fact, transmission was retroactively corrected upward, and that creates more uncertainty. And there is more to read here. The population in the southern states, which you need to know, the southern states are peaking, the northern states are still rising. And you can see here there are multiple different scenarios that could happen. It does look like we are going to start to drop very soon. You can see here it does look like we're at a peak right now, according to Mike Horger and his PMC COVID dashboard. If you want to read his full report, you can go over to pmc19.com/data, and you can also follow him over on X at Michael Horger. There it is right there. And like I said, there'll be a post on my website today. This evening, I'm going to make it a post where all the things that I use today, including a link to this. So you'll be able to see his entire dashboard. All right, I mentioned Missouri a second ago. Let's just do that next, shall we? Sunnyview reports COVID-19 outbreak, 3 residents and staff sick. Yep, this is in Missouri. Sunnyview Nursing Home and Apartments has confirmed a COVID-19 outbreak within the facility, reporting 3 residents and 1 staff member testing positive. Effective immediately, the nursing home is implementing several precautionary measures designed to safeguard residents, employees, and visitors. All residents and staff will undergo testing twice weekly until further notice. Staff are required to wear face masks at all times. Hey, there's something we don't see very often. And anyone experiencing symptoms of illness is asked to remain at home and delay visiting. We're going to stop reading this there again. You'll be able to see all of this. Moving on now to this. Experts urge caution as dengue fever cases climb in Brevard County. This is in Florida. Yes, that's right. Dengue fever is a problem there. The Florida Department of Health is warning families in Brevard County about an uptick in mosquito-borne illness, specifically dengue fever. So, yeah, that's not good whatsoever. Moving on up to Canada now. I said there's a lot of news today. British Columbia CDC confirming 5 new measles cases in Northern Health Region. That's not good, and the province is now up to 265 cases total. All right, moving on now to this. Colorado sees West Nile virus surge with cases doubling other states' totals. CDC data shows West Nile virus around the United States is 40% higher than normal this year, with cases in the triple digits in Colorado. Yikes, that's not good whatsoever. Colorado is not doing well this year. The United States has seen more than 770 cases of West Nile virus. According to the CDC, 150 of them are in Colorado. So West Nile virus is a problem in the United States, but a bigger problem, and the biggest problem, would be the state of Colorado, where there's up to 150 cases now. Yikes, that's not good whatsoever. All right, remember we were talking about Iowa and Legionnaire's disease? Yes, Marshall County, Iowa. Well, guess what? A dozen more cases of Legionnaire's disease has been reported in Marshall County over the past few days, putting a total number at 52 cases. There you have it for the news portion of today's update. Now we got a lot of data to take a look at. First off, we need to take a look at what is going on with air qualities in the United States. I think it's very important that we do that. We need to know how it is for your breathing. And we can see the West, it's gotten a little bit better. The Rocky Mountains have gotten better. Still some troubled spots in Southern California. You're still seeing some oranges. Better, but still trouble spots in the Pacific Northwest and Canada as well. And then we see a lot of yellow and orange east of that Mississippi River. Just some generally, I don't want to call it really bad air quality, just poor air qualities. And it would be even more poor in these areas that are in orange, such as Louisiana, eastern Texas, Arkansas, Oklahoma, Missouri, even portions of Kansas, and maybe even Nebraska and Iowa. Missouri, yeah, western Missouri as well. Taking a look at what's going on with the viral activity levels in Canada, has not updated. COVID-19 is moderate, flu A is low, flu B is low, and RSV is listed at low at this time. Taking a look at what is going on now with EMS calls in Pinellas County, Florida, sick person is showing up just one time today. Hey, that is some good news. Taking a look at what's going on in Philadelphia with EMS calls for Monday. We should get that in a moment. There it is. September 15th, Monday. 828 EMS calls were reported, and we always do like to repost that, or otherwise known as retweet, so let's do that. Taking a look at what's going on in Montgomery County, Pennsylvania. Both Montgomery and Chester County have been really busy today. I do see 2 respiratory emergencies in Montgomery County right now. How about Chester County? Let's check that out, shall we? And, look at that. Chester County, literally just right now, just did a update to their whole entire page. This is new. They're putting all this stuff on the bottom. Okay, anywho, not as busy as it was this morning. If you saw this morning's YouTube short that I did, about the Google Trends for sick people, you saw that Chester County was really busy because I decided to show that in there. Not as busy as it was then. That is some good news. Hey, we'll take it. Now, how about the hospital situation in Pennsylvania? Well, that's still problematic. Take a look at the Lehigh Valley. Some problems in southeast Pennsylvania, Lehigh Valley. Problems in northeast Pennsylvania, too. And just one problem down in Gettysburg. And, yeah, that has not been updated since August 25th. I want to say that has likely changed at this point. Taking a look at what's going on with the hospital situation in New Jersey, and we do see normal at the majority of the hospitals. However, RWJBH, Robert Wood Johnson University Hospital, is dealing with a psychiatric issue, and hey, that's the only hospital with a problem in New Jersey. Alrighty, now let's take a look at New York. But before we do that, let's pause and take a hydration break. Let's drink some water, shall we? Alrighty, doesn't that taste much better? New York State today, 677 new cases, but we do have a problem. Yeah, we've hit a new wave high. Take a look at this. The number of hospitalizations is now at 462 with 50 people in the ICU. So they did go up, and you're probably thinking, that's got to be New York City doing that. No, you'd be wrong if you thought New York City. We're going to go down the list here, but we'll go to New York City first. No, it's not New York City that did that. New York City is actually not at its wave high right now. Let's go to Western New York. I want you to see this. Yeah, Western New York went up a little. Now, it's only 27 people hospitalized, but the prior report they had 18. This is the highest that they have had since, 27. It's the highest that they've had since April 30th. So that's interesting to see. Here's the southern tier region. And we can see that went up compared to the most previous update. 10 people hospitalized there. North Country is not doing terrible right now. North Country is okay. Then we go to Mohawk Valley. And we can see Mohawk Valley of New York. Yes, that went up slightly. Mid-Hudson Valley, similar deal. That went up slightly, but not a wave high. Then we see Long Island just had a huge spike. Take a look at that. 91 people hospitalized versus what we saw on the last update for last week was 71. So that did go up. And we might as well show you the Finger Lakes. There we go. Not concerning there. Here's Central New York. See, that went up. Not a wave high. And then finally we do come to the capital region. And the capital region also did not hit a wave high. So Western New York and Long Island being the big contributors to this pretty big increase that they saw in New York State today. The question is, the wild card is, before the wave peaks, will New York State reach 500 hospitalizations? I can't answer that question. I don't know if they will or not. It's possible they don't. It's also possible they do. It's probably a 50-50% chance, in my opinion. All right, taking a look at wastewater scan, and we can see here, I do want to show you the nationwide levels. Pretty much high for COVID everywhere still. You're seeing here the Northeast. I want to show you this. It's showing a drop in the Northeast. I don't really agree with that, because I think it's being flawed for a couple of reasons. Number one, we have 2 wastewater sites in New Jersey not reporting. One is a huge one in Newark, New Jersey. The other problem is, take a look at Boston. Boston has 2.4 million population at their wastewater site. It's listed high, and it's dropping. I think if that wastewater site was X'd out, I think we'd probably be seeing a different result. Take a look at Stamford, Connecticut. Yeah, Stamford, Connecticut's not really dropping. They're not really rising much either. They are still elevated there. Union Beach, New Jersey, you can see that's still rising. That's only 100,000 population. Then you come over to Pennsylvania, and wait till you see this. Harrisburg, Pennsylvania. Yeah, rapidly going up. So again, there are still places in the Northeast that are rising. It's just we have a very big wastewater site that is now dropping. What's going on in Hagerstown, Maryland? Yeah, that's still, it's not dropping big just yet. Still listed high for COVID as well. Alrighty, we should look somewhere else. Now let's take a look at what is going on in San Francisco, California. And we do see here that San Francisco, California, yeah, still rising at this time. That is not good. This is the more western wastewater site. How about the eastern one? Let's see. The eastern site is actually medium and dropping, while the other one is listed high at this time. Now let's take a look at some data from CJS. These are new numbers, updated a little bit late. Normally we get to this on Saturday. However, CDC was late in updating. I don't know if we're going to read all this. I think we may. We may just make this a really long video today. Starting off with numbers from last Thursday. Arizona, 1,841 new cases and 153 CDC reported hospitalizations and 8 deaths. Colorado, 261 new positive tests, a test case positivity rate of 9.57%, down from 11.49% the prior week, which was the week of August 24th through the 30th, and 3 deaths. Hawaii, 491 new cases, a test case positivity rate of 8.7%, down from 10.6% the prior week, and 3 deaths. Idaho, 523 emergency department visits and 2 deaths. Indiana, 1,065 new cases, 142 CDC reported hospitalizations, and 5 deaths. Kentucky, 737 new positive tests, 141 CDC reported hospitalizations, and 3 deaths. Massachusetts, 1,620 new cases, 181 CDC reported hospitalizations, and 5 deaths. New Mexico, 607 new cases and 2 new deaths. North Carolina, yikes, 535 hospital visits for COVID-like illness. The CDC reported 519 COVID-related hospitalizations in North Carolina and 21 deaths. Oklahoma, 969 new positive tests, a test case positivity rate of 11.2%. It's down from the prior week, which was 11.8%, and 1 new death. South Dakota, monthly number, 630 new cases and 1 new death. Now some Friday numbers. All listed numbers are weekly numbers, and all listed death counts come from the Centers for Disease Control, CDC. As any state reported death counts from Friday were posted then. Alabama, 241 CDC reported hospitalizations, 4 deaths. Georgia, 365 CDC reported hospitalizations and 14 deaths. Illinois, 279 CDC reported hospitalizations and 6 deaths. Michigan, 124 CDC reported hospitalizations and 9 deaths. Mississippi, 10 deaths. Montana, 262 new cases. Nebraska, 304 new positive tests, a test case positivity rate of 11.7%, down from 13.5% the prior week, and 2 new deaths. New Jersey, no state level reporting this past week, although I will note we did get that little summary from New Jersey. 235 CDC reported hospitalizations and 11 deaths there. Ohio, 276 reported hospitalizations and 16 deaths. Oregon, which reports state-level data on Wednesdays, 127 CDC reported hospitalizations. Pennsylvania, my state, 486 CDC reported hospitalizations and 18 deaths. South Carolina, 245 CDC reported hospitalizations and 9 deaths. Tennessee, 167 CDC reported hospitalizations and 9 deaths. Washington State, the state of Washington, 179 CDC reported hospitalizations to go along with the 994, this is a lot, 994 emergency department visits and 9 deaths that were reported by the state last Wednesday. West Virginia, 602 positive tests, a test case positivity rate of 11.81% and 2 deaths. Wisconsin, 733 new positive tests, a test case positivity rate of 10%, up from 9.9% the prior week, and 5 deaths. The CDC reports a national test case positivity rate of 10.8%, unchanged from the prior week, with 10,414 nationally reported hospitalizations, up from 9,653 on the prior week, an increase of 7.88%. And the CDC added 405 new deaths. His count, I believe, is slightly lower than the BNO count, but hey, we're over 400 new deaths in 1 week. Yes, deaths going up. You kind of saw we used that thumbnail and title yesterday. 405 deaths since the posting on August 30th, and now shows 1,232,105 total COVID deaths. Note, the 3 most populous states, California, Florida, and Texas combined, have 3,960 of the nation's 9,653 COVID-related hospitalizations, or 38.7% of the national COVID hospitalization count for the week of per CDC reporting. All right, a little bit of bonus coverage here. Florida numbers. It looks like Florida had 3,601 new cases. I guess this is over the weekend, including 648 today, meaning yesterday, and 39 new state-reported deaths, including 1 from 2023 and 1 from 2024. That was over the past 3 days. New York, and I need to zoom this out. New York had 3,037 new cases over the past 3 days over the weekend, including 943 yesterday. Puerto Rico, 881 new cases, including 509 yesterday. Texas, Friday, which finally came in on Monday, 7,854 new cases, 1,150 CDC reported hospitalizations, and Texas added another 49 new deaths. There you have it. That's the Tuesday edition of the Virus Update. If you enjoyed today's Virus Update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Ways to support the channel are listed down below. We'll have another update again tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Tuesday evening, and thank you for watching my video. Take care.